All right, good morning, everybody. So happy to have you all here. Today we are privileged to have a nice visit from the Village to Village Network with Barbara Sullivan. She's going to give us an overview about the network and how we can use or utilize their organization for what it is that we do with our senior homeowners and families of senior homeowners. So thank you, Barbara. Thank you so much for being here. And tell everybody where you're calling in from.
So I am calling in from the Jersey Shore. And I'm sure everybody's heard of the town that I live in, and I'll bet you $1 if you don't. My town is called Ventnor, Ventnor. Anybody hear of it?
Never.
Yes, you have. Yellow on the Monopoly map.
Well, see, that's the first thing that came to my head was Ventnor Place. And I thought, no, but that's amazing. That's amazing.
Yes. So it's quite chilly here today.
Is that near Manasquan?
No, we are about 30 miles south of it. I am about 2 miles from Atlantic City, and then Cape May is about 30 miles south of us. So we're the last of the barrier islands along the shore.
30 miles doesn't seem that far, though.
No, I mean, it's down the Garden State Parkway. It's not too bad. But again, these are barrier islands, so it's 30 miles is a good 45 minutes because you have to get on and off the islands, bridges and connections and whatnot. So it's not bad. I'll take it. Amazing. But thank you all for including me today. Julie, I guess just an overview of V2V. I'm going to share my screen and show you a little PowerPoint. Not that, sorry. Okay. Everybody see that?
Yeah.
Okay. Let me just get my head out of here. There we go. So, believe it or not, this is an old slide. I got to update this. This year, 2025, marks the 25th anniversary of the actual village movement. It started in Beacon Hill, as a section of Boston, with a group of people that decided they wanted to stay in their homes and in their community and, change the paradigm of aging. They didn't want to go to institutions. They wanted to see what alternatives were out there. And so they formed some committees and decided, let's research what's needed to stay at home and in our community. And fast forward, it opened 2 years later in 2002 to become the first village in the network. Villages are geographically designed, and we talked a little bit while you all were jumping on. They are organically grown from the communities they serve. So they're all grassroots. They have a volunteer first mentality. And their purpose is to, enable people to age at home, but more importantly, in the communities they love and have lived in. So the home is defined, but, a lot of times home is not where you really need to be, possibly. And so, but the community and your lifelong established, relationships is super important. I'd say probably 99% of all our villages are 501c3s. And so part of getting a village organized and opening a village is to look at the financial sustainability of a village. And we'll go into that in a little bit. So the villages, the mentality was, the demographic. It was aimed towards that middle class, and it still is the missing middle. And we hear that a lot. And we, the missing middle were not, poor enough to receive some states, funding or, but they weren't rich enough to, pay for some of the traditional needs by staying at home. And part of what Beacon Hill founders looked at was, looking at tossing away the traditional resources and really kind of looking at a neighborhood, neighbor to neighbor mentality of helping each other as we age. I always lecture around the country about, what it is to age. I mean, at 65, what am I going to be in 10 years? And the first thing I ask my audience, usually when I have a lecture or I speak to people, are, so how many of you out there have a long-term care policy?
I
And
sell it.
pardon me?
I sell it.
Okay, sorry, I'm jumping around here. Well, in the audience, I'd say less than 10% raise their hand. And what I say is put your hand and keep it up in the air and pat yourself on the back because you now have plan B. But a lot of us, as we age, we may not be in a house that is conducive to aging. We are looking at, care with chronic diseases and, how to navigate it. Personal fulfillment. I mean, that's a big part of as we age, we're retiring. What are we going to do? What's our purpose? And all this is encompassed with not just being a member of a village, but being a volunteer for a village or being a supportive, how are we going to support ourselves as we age? And we'll talk about some of the services in a minute. Caregiving needs. We all know, and we've heard it ad nauseum, the workforce shortage. Who's going to be out there to help us as we're at home or in even institutional settings? And so we take all this in when we look at the village model. So here's your village model. And the village is right in the middle. You have members, volunteers. As I said, most of them are 501c3. So you have a board or a council. You have, which is super important, the partnerships within the community. 60% of my villages have at least 1 to 2 FTEs. 40% are all volunteer. But what they do is they coordinate all this, the service providers, home repairs, the social connection. It's super important to keep in mind that, the social determinants of health, which we all have heard ad nauseum about, is about keeping connected. And so villages plan programs, they do cultural outings, they have friendly visitor programs. As far as the volunteer-based, villages do everything from grocery shopping to transportation to companionship, as I said, technology support. Some villages do coordination of services. Many of my, what I call monster villages, which are the bigger villages, have social workers on staff. But many of them are partnering with their local, area agencies on aging, which we refer to as the AAAs, or, their county and state, support systems. I know I had mentioned to the group prior to this, I ran a village for 10 years in Northern Virginia, and Fairfax County had, which was my county, had a great resource through their AAA. If somebody needed more care and you needed a social worker, it was a sliding scale and you could have that, somebody to help coordinate services. And then the health related services, exercise classes, we did a lot of them do health advocacy, where somebody goes to the doctors with you. So there are different types of villages out there. And I think there's an expression that people hate to hear it, when you've seen one village, you've seen one village, but it's very true. Not all villages are the same. They have similar characteristics, but their business models may be a little different. They may be sponsored by, like my village here in Ventnor, New Jersey. We have a village called Village by the Shore, very catchy name. But its parent organization is Jewish Family Services, and they help to do the continuum of care, but it's a parent organization. We have a couple of hub and spoke models out there, and basically, and there's a couple in California, that Marin County is one of them, where there's one central office, and then the spokes are different locations in Marin County. It helps to, navigate some of the finances, but also, you know, the back office and whatnot.
Avenidas in Palo Alto is one of those.
Avenidas is a part of, yes. And we're going to talk about that in a minute too. I have some very large hub and spoke models out there. The state of Rhode Island has one. There are 9 spokes. There's 1 hub and 9 spokes, and the same in Portland, Oregon. There's a main hub, and then there are, I believe, 10 spokes throughout you know, Oregon and actually going into Washington State that are part of that hub and spoke model. And I can't say enough about, you know, the partnerships that villages create. And I say it a lot. We not only, we learned from COVID. I think all of us learned from COVID. For many years, the aging sphere was, everybody was silos. Nobody was working together. Nobody talked to each other. No coordination of services, nothing. And home and community-based models like the villages, we not only survived COVID, we thrived during COVID because we were so grassroots. We were able to connect with our folks. I lost maybe 1 or 2 villages during that time period who shut down completely. But the rest of them, they carried on. They were able to, you know, obviously we couldn't do transportation, but we were able to coordinate, you know, groceries. We were helping get vaccines. We were helping to do a lot of the things that people, you know, who were stranded alone, you know, especially the older adults, they were connected still. And it was really a positive, but also walking through that, we started creating more relationships within the community with other aging organizations, like the area agencies on aging. Some of the things that, you know, when you're starting a village, you have to look at: funding sources, membership dues. I'd say 60%, as I said, 60% probably have some type of dues or a sliding scale. Most of our villages, if they do have dues, they have a scholarship program for those that have low income. We have, there's a lot of grants out there. Donations, obviously, with the 501c3, you can do fundraising and, you know, donations. And then we do have some Medicare Advantage programs that they vary state to state, but one of my villages, and I'm going to talk about that in a minute, really heavily works with their state with some reimbursement from Medicare Advantage programs. And we're dipping into that a little bit more as we move forward. This is a great resource. It's on our front, you know, website, on our homepage of the website. It's a little, it's, if you go to our website in the down right-hand corner, all you have to do is click on the picture and you will download. It's 70 pages of a handbook on how villages are working with their area agencies on aging and how they're getting reimbursed with the state units. It's a fascinating study. I think San Francisco was in it, San Francisco Village, and I'm trying to think of the other ones. But anyway, great resource. The other thing that we've been involved in is, for the last 18 months, we got a PCORI award, and we have been doing a research project with Rutgers and Rand on healthy aging and villages. And the report should be out in the next couple weeks. It's due out shortly, but we did virtual summits throughout the summer last year and focus groups. So we're very excited about this prospect. We're also involved, sorry, jumping around here. We're also involved with village data collection. The VIP project is just getting off the ground. We're trying to come up with some taxonomy to, you know, get our villages to be able to, you know, have like-minded data sets. So, but we're just kicking that off. Here's a village map. As you can see, if you go on our website and you can say, where is if I have a village near me, you can type in your zip code and it'll show you how far. As you can see, it's very heavily concentrated in the Northeast and the Mid-Atlantic. Some in Chicago, but the Pacific Northwest and the West Coast, very heavily concentrated. And that's me. But I'm gonna stop sharing and I'm gonna put, so the nice thing about, and I'm assuming most of you, I'll
Oh,
look up this.
sorry,
David,
can
I'll
you
look it up
go
for you.
back to your last slide with your contact, please?
I'll put it on the group chat.
Oh, okay, thank you.
Here's a, and I don't know if you know about Village Movement California, but it's our regional group. There are 50 some odd villages in California, and Village Movement California has started an incubator program to accelerate the opening of villages. And we do have other regional groups. The largest one we have is in the Washington metropolitan area, WAVE, Washington Area Village Exchange, the DMV has about 85 plus villages in the Washington metropolitan area.
And I point out some comments here that came up.
Yeah.
There's a statement here that it says, I live in the San Jose area. And well, unfortunately, Joseph lives in what's called the villages out here. Now, unfortunately, the name village is used quite loosely in a lot of these living situations, and the virtual retirement village, which we're talking about, is not the same as the villages out in San Jose or the one in Florida or any of
Correct.
those.
Right.
And also, there's a comment about being associated with another institution, and it's not. It's basically all the homes in an area, so they're all aging in place people that live in their homes, and they benefit from the services of the village. It's not a senior community that everybody's living in. And also then David says he did a check on 75 miles of San Jose. Well, Avenidas in Palo Alto, of course, San Francisco Village, San Mateo, Oakland. I can't think of any more in the Bay Area, but they are in the Bay Area, though.
Right. So here I'm going to share this once again so that you can see. I will be honest, our map is not very intuitive. We rely on Google Maps, and you are correct. The village model is not the same as your village. It's not a brick and mortar. So a village is comprised of, as I said earlier, the community that they serve. So we have villages that are formed out of faith-based organizations. There's there's two villages in the LA area called High Village, and they serve their congregation. The two temples. We have a village that's in a high-rise building in Oakland, California, that's called Hotel Oakland Village. And it is a Section 8 housing for, primarily Asian American. So it's really, I mean, we have villages that are 14 square miles. We have villages that are 14 square blocks. But the premise is to help support people aging in their homes.
So it's virtual, basically.
Some of it's virtual. I mean, it's virtual in the fact that the offices are, but,
Yeah.
they bring people together.
Yeah.
They support them in their homes by, providing, as I said, maybe it's, that technology support. Maybe it's that, friendly visitor. Maybe it's taking somebody to a grocery store. It's keeping people engaged and helping support as we age, in the areas to stay as independent as you can,
To help understand it better, you might want to use an analogy of a neighborhood association in structure. The village is similar to that, and that explains why there's no building. It's not brick and mortar. You can't take a picture of it. It's not just virtual. I mean, they do have other things, and it's not just for retirees. A
It's
lot
a
of,
membership organization.
yes.
So, and that's the first thing I said. They're membership organizations, not necessarily, I would not equate it to an HOA because many villages don't have dues. You can just join as a member. The biggest issue as we age, is being as independent as we can. And that includes, I've got a window that's in my face. Uh, anything that you, as we age, we have our independence taken away from us chip by chip. So being able to stay as independent by doing it through your neighborhood, through neighbor helping neighbor, is the premise. I see also, what is the fee for the membership? For the membership to V or to, so all our villages that join Village to Village Network, we're a membership organization also. So we help not only get villages to start, and we have a village toolkit, we have a mentor group to help, communities start their own villages. But the other side of the coin is we're also 50% of what we do as the national network is advocate. So our advocacy efforts are, helping, which didn't pass, the Older Americans Act money, looking at workforce shortage, looking at the grant monies that may not come back. We were very big with the vaccine initiative. We got several federal grants and gave them to our villages to, do the vaccine incentives. So David, as far as your local village, I can look it up and see if you need,
So is Avanitas you were going to talk about Avanitas and its relationship with your Village to Village.
I
Or-
was.
Yeah, you had mentioned earlier that you were going to talk about your relationship with Avanitas here.
Not per se. I mean, they're one of our members.
Mhm.
Let me look it up and I'll show you my people manager.
Again, Avenues is the spoke system, and the village is just one spoke.
Oh, yeah.
What
Oh,
they do.
okay. That's why it's not pulling. It's part of the hub and spoke with Marin, right?
Yeah,
Yeah.
I think that's what you
And
mentioned.
that's why, so Marin is different in that they choose not to put their villages on our map. They'd rather you come to there, and that's up to them. They rather you come to them. They coordinate all the services. If you live within their boundaries, then they work with you, in that capacity. Other villages, who are hub and spoke, show all their spokes. So it's really up to the village itself how they want to, navigate, service requests and inquiries and whatnot.
So if we had a group of us that wanted to start a village and engage with the Village to Village network, how does that work?
Well, I mean, let's say you decided you wanted to open a village. So like I had somebody call me today who, I'm trying to think of where he was. Oh, up in Maine. And he said, and actually he was a realtor. And he said he wanted to start a village. And I said, well, who are you working with? And he said, well, just myself. And I said, come back to me and, when you have 5 friends, because it doesn't work that way.
Mhm.
And what I did say to him was, though, you have a very active, and he was in Southern Maine. You have a very active village in Portland. And my first suggestion is go and sit down with them. They're, within 45 minutes of where he was. And I said, have a conversation. They may want to add you as a spoke, and then you don't have to reinvent the wheel. What we're trying to do is scale the movement without having to have a heavy lift. I mean, the reality is it really does take 2 years for a village to, get up and operating.
At
By the time
least.
at least, oh yeah. Unless, and so there is actually a big push with Village Movement California with this accelerator program. The incubator really, they're doing workshops and they're starting to scale. And I hope that every regional group starts doing it. I know the ones in the Washington, D.C. market, that Montgomery County are getting money from the Maryland, state legislator, and the Virginia folks are too. So the one, thing I know as we move forward this year, especially in the next 4 years, is that people are really going to rely on home and community-based services. We are going to see a tremendous need because the services are being cut left and right, and we're ready for it. And I think we're going to show it's going to show a need with these, community-based models. We are working nationally with our partners. I'm actually on the board of Leading Age, which
yeah.
is so I'm on the national board, and we are working together because they know more than anything else, what we're facing. And working with these local community services is a plus for everyone.
Absolutely.
And I have to say, the model has evolved. We're no longer that white middle, class, type of village. We have Hispanic villages. We have faith-based. We have a great one in DC called Kingdom Cares, and it's out of a African American church, and they created a village. We have villages that are coming out of senior centers. You name it. They're taking the model and they're making it their own. So it still has the same characteristics. You're still working with community members. You're still looking for volunteers. And don't forget, we've got a lot of boomers that are retiring. And maybe a lot of federal employees right now. So we might have an uptick of volunteerism. But
Yeah,
it's
I had a conversation yesterday with a colleague who has a client who is looking to relocate to move to her next forever place and would like to move to a Jewish community center place. So she works at the Jewish Community Center, our local one. And I was like, well, why don't you just have her get online and find out all the Jewish community centers that are involved with each other, and she could just go that and start there and see if they have places or geographies that she might be interested in. And you probably have, groups within your groups that are, specifically culturally like that.
right. Um,
Well, I could give you an example of what happened here with the Silicon Valley village that we tried to start in, well, between 2010 and 2012. We worked on it very diligently. We had some really strong leadership, but we weren't able to woo the people in to join. They were all saying, well, I'll wait until I see who else joins and take it from there. And then, as it turns out, we weren't able to get the funding for it either. And unfortunately, we had to let it drop. But Village to Village Network was very helpful, very instrumental in getting a lot of the structure that we need and filling in the holes. And they absolutely have to be included, as an incubator system when somebody's starting a village because it. And the other thing is that they're all so different. When you've seen one village, you've seen one village.
and we say it
All
all the time. I know.
Yeah, they're so different. If you get to be familiar with one village, that doesn't necessarily mean that another one is run the same way. So you have to kind of look at them and see what their different personalities and offerings are.
But the characteristics, and that's what I said in the beginning, the characteristics, many of them overlap. I mean, it is
That's
supporting
true,
people,
yeah.
then, yeah. So, and that, it's a good thing because, you know, my cookie cutter community here is not going to be the same as 2 towns down or, you know, whatever. Our needs are different. But I think villages are a great resource. I wish there were 1,000 of them instead of 280 open and 50 in development. Um, you know, every community should have them. The one wrinkle, and I think leading age helps us with this, is that we still have to do the continuum of care. We still have folks that may not be at home much longer, that need that support. And that's where the partnerships come in with villages, to be able to reach across and say, okay, the assisted living down the street, you know, my husband's got, you know, mid-stage, you know, dementia, and it's time, he's not safe at home anymore. And developing relationships within the community, and the resources.
I'm just visualizing residential assisted living, single family home, board and care, such type of situations, all connected by a village to village network. It could be very supportive in that business model. Because we're not going to have enough inventory of places for people to age in place.
Well, and it's more about the financial aspect too. I
Mhm.
mean, unfortunately, the statistics are probably, you know, about 18% of the population can afford long-term care. You know, what
Yeah.
about, and people, and the misnomer is that people think that, um, Medicare is going to help or this or that. But we are really pushing, and we're working with the PACE programs. I don't know if you've heard of
Yeah,
PACE.
we're very
Okay.
connected with our local PACE. Uh-huh.
We're working with PACE. In fact, I have a board member who works for PACE. So, but again, they're not in every community. For those who don't know PACE, PACE is a program of all-inclusive care for the elderly, and it's typically it's a public-private relationship. It usually goes with a hospital system or a state, state or local office, and then the PACE program itself. But it keeps people home, who are that level, that nursing home level of care. I know somebody just put another question in the chat.
Yeah, Joe, you can ask questions. Joe.
Yes, I was wondering, is that for everybody aging, or is that for homeowner or both?
Well, it's for both. I mean, you could be you don't have to necessarily be a homeowner. I mean, you could be renting your place. You could be living with your son and daughter. It's about supporting you as an older adult, and being able to stay as active within the community and stay independent. I mean, there's some peace of mind in that. You don't have to call your children as you're aging and say, "Oh, I have to, go to the doctor," and you feel guilty and this and that. You're independent still. You're part of an organization. You're part, and you still have control of your own life. And I think that makes a big difference when you're maintaining independence and aging. David, you said you have some faltering things about PACE loans. I don't know what. No, it's not a PACE loan. PACE is a program. It's a federally funded program called Program for the All-Inclusive Care for the Elderly. And it is a Medicare, Medicaid, supported service where they come into the home. You have doctors, therapists, you name it, food, everything's, delivered to you, to your home. And then you can go to a PACE facility if you need, services. The
We-
downside of PACE is that you have to use their doctors. That's the only thing.
We have a local resource called WellBe Health. They're our local PACE provider. They're new to our market. They're right here close to me on Hamilton,
we-
close to Lee.
We did a session on them a couple weeks ago. It's recorded.
Yeah, and
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 Also, Onlock is
yeah, and
the other
Onlock too is a
in our
PACE
area.
provider. Yeah.
Yeah,
It's
I
exactly
actually
the same.
went to their presentation a couple of weeks ago, and then I visited the facility last week.
Mm-hmm.
It was pretty good. I want to find out more. Actually, it's a good program. Looks like it's all inclusive. Yeah.
Barbara, the WellBe Health organization that we have here, that's our local PACE program, in collaboration with Onlock, which is an organization that has been around for a long, long time. WellBe Health is new. Onlock's been around for a long, long time in the care of our senior community, and they work together with the local county and state agencies with the seniors to get them evaluated and qualified and into the services. So they've really done a really good job, especially in our area, because we have such a diverse demographics on creating and the opportunity for the families to have these services available. And the whole point is, and this is what we learned, Joe will tell you, is that with their help is that seniors can stay at home and not have to go to the nursing home. So that's the whole benefit there. And then for us as seniors real estate specialists, we can help our families by knowing that that service is available with families that might be in situations where this might be a good option for them.
Well, just keep in mind that this is not necessarily connected with the village movement. They can, in certain villages, maybe be associated with the PACE program, but don't think they're the same thing.
They're not
And
the same thing, no.
and also, Joseph, to help you understand a little bit better, the only thing that you need to have to join a village is to be located within the boundaries of one. And then if they have dues, you'd have to pay them, but otherwise you can join for whatever they have. And most of them have a concierge service where with one phone call, you can get a ride to the doctor's office, somebody to fix your leaky faucet, and maybe a partner for your canasta games. So it's a great service, for the people that are able to join it.
You're right, Skip. And, I know people toss around that term concierge, but I mean, it really is, thank God there's some great software programs out there to help navigate it, and when you get a request, the volunteer can look at, the big picture and say, oh, I'm going to the grocery store that day, or I can take that person, or I can come and fix, Mrs. Smith's, printer or whatever. And so, or hook up and, go to a canasta game. I know there was a question about, the dues. The dues structure for each village is different. As I mentioned, 40% of our villages are all volunteer. So it's truly, member to member type of volunteers, or, just the volunteers themselves. We have villages that have no dues. We have villages that have a system called pay as you can. We have villages that have hefty dues. My village in Northern Virginia, I call it hefty. Some people may not be able to afford it, but for a single person, it's $600 a year or $550 annually. And for a couple, it's $900. But I got to tell you, and we came up with these numbers, they have staff, so you can call in. But if somebody took a cab or an Uber to the doctor, it's $15 each way. And public transportation, you'd think the DMV would have great, we have Metro and whatnot, but we don't have sidewalks in Northern Virginia. It's a bedroom community. And it's very hilly. So to get to that bus stop, it doesn't matter if you're old or young, even a stroller, you can't get, you can't walk on, you have to walk in the street. So it's not conducive to the older population to take public transportation to their doctors. And so And then you multiply that by having to take a cab to, get your groceries, that type of thing. So having, a support to be able to have the flexibility to do more programs and to do, is a good thing. Does V2V provide structure to help local groups set up this kind of thing? You mean as far as a new village? Yeah. David, can you explain your question?
Sure. I mean, what you're saying sounds great, especially obviously for seniors in areas in which we live and stuff like that. But at the same time, I'm looking, I'm trying to get my head around how you set one of these up or put it together or whatever, because there's
Good question.
obviously a lot of coordination and stuff going on here. This is
Right.
not a a small venture you're talking about.
No, so good question. Should have mentioned it. So we have a membership with V2V called the Opportunity Membership, and for $200 a year, you can join V2V, and you have access to all our documents, which includes a Village 101 toolkit, and it's a 70 odd page document that gives you step by step how to start a village from conception to asset mapping, or what I call a needs assessment. One of the biggest things that a community needs to look at is what is needed, what is existing, and and how you can combine the two. It is a great toolkit in that it gives you guidance, but then also we have a mentor program that we have seasoned village members. We've been in, for since 2007. I've got the institutional bank in my head of, what's next, what to do, how to form your board, your governance, how to, and we have workshops throughout, so we have a workshop once a month on Village 101, just, questions, insurance, just the individual things that come up, how, opening a village is like starting a small business. So it's step by step how to get, organized and get it going. The best thing I can tell you is, doing a needs assessment and doing surveys and looking at where, I mean, you guys have chattered about San Jose. Look and see what's been out there. I mean, has somebody started? Is there a going and sitting down with your area agency on aging and saying, we're thinking about starting this and we want to know if you'll support us. We're not asking you financially, but we're asking for your institutional knowledge on, what's existing services and how we can partner. The
Oh.
best thing I had when we started our village, I had a county supervisor. He truly believed in this model, and he had a town hall meeting for us. I have a village in Ohio. The mayor, it's outside of Columbus, loved the model, and they want to do a survey with older adults. So he put the survey in their water bill. It's just inventive. I know it's crazy, but it worked, So we give examples. And then, like I said, we have the workshops and the one-on-one mentoring with other individuals. So I hope that helps.
One of the other perks.
Who is
Wait,
it?
David had a follow-up question. Go ahead.
Sorry. Who is it that sets these up, do you find normally? I mean, this sounds like it'd be a pretty heavy project for an individual per se. I mean, you mentioned like the Jewish network services and stuff like that. How does?
Well, as I said, David, it's really organically grown from the community. So you have a group of homeowners that say, I want to start a village. We want to stay in our homes. How do we do this? And they go from there. Yes, some organizations start it, like you said, the Jewish Family Services, like mine here, my village here started out of JFS because they saw the community need. But it really does take a core group of homeowners or people who live in the community to say, I want to see this come to my community so that I have it when I need those services. And it does take a core group of people, and it is work. And Joseph asked, how do you qualify to join one? There's no qualification. The only thing that I will say is that villages do not do medical. So they're non-medical. We don't, none of the villages do, non-ambulatory transportation. They don't do dementia care. They don't do, any of the ADLs, activities of daily living. That's not, we're not a medical model. We are non-medical and support services to help people age in place. And no, there is nothing in San Jose right now, Joseph. So, that would,
Avenidas is our closest right now, Joe.
right.
But it's,
But I have to put the caveat, I put in the chat before, Village Movement California has an incubator going. And that might be your next step if you're really looking to maybe start one, because they have an accelerated program that's right there in California. And they may have something that is starting, but it would not necessarily be on my map because it's just, in an incubation stage.
how do you find the incubator then?
Village Movement California.
Oh, okay.
Oh,
The
okay.
other thing that you didn't mention is actually one of the other perks is that there are groups of vendors that are vetted that people can use with, and most of them are, within the confines of the village, and a lot of them will offer discounts that you get from somebody just out of the yellow pages. And then I know one village that has created a barter system where each person has their own particular skill and they can do work and earn points and then use that as a trade-off for other skills that would be involved in the vendors within the village then too.
That like a time bank. Yeah.
Yeah.
Right. And that was mentioned in the model. So I didn't mention it, but it was in the slide. There are villages, I don't think villages like using the term vetted because then there's a risk issue about, referring to, but there are some partnerships and, like my village, we most certainly interviewed like home health agencies, and we would say to our member, we had 3 or 4 that we interviewed. We got letters on file that they do background checks on their, so technically we're vetting them, but that they do background checks on their employees and they're licensed and bonded so that we do our due diligence. But then we in turn tell our members, other members have used A, B, and C, and here's 3 vendors that you can, check out and let them make the choice. And that's a wiser, but you're right, Skip, that some of them give discounts. Our best thing that we had was a hardware store that was in our community called Village Hardware, believe it or not. And they had an ongoing list, and God love the owner. He would keep it. He was merciless. He would keep a list of contractors, and if they made one mistake, they scratch them off. But they were reliable resources through this local, hardware store, which was great because people were always looking for a handyman or this or that. And that was, if you ask about the services that volunteers do, the top 3 that I had were always transportation, the handyman or the honeydew, somebody who comes in and I know it's cliche, but change the light bulb, or I can't, my door's stuck, or, even replacing a washer, on a sink or whatever. There are lots of folks that are retired or looking for something to do, and the honey-do list is always a great one. They're not out there to paint or do electrical, but there's always things. And I always think about the holidays when somebody's home, they're not getting holiday decorations out because it's either in the attic or it's in the basement, and so having a volunteer to come over and help you, engage in a holiday celebration is always an important aspect of being, engaged. Yes, David.
I had a quick question on, so I went on the Villages Movement in California, and There are some in the Bay Area, you know, Palo Alto, Santa Cruz, some other areas. So are those established villages, or what is it can you give me
Yeah.
any idea what I'm looking at?
Are you on the map or?
Yeah, so I went to villagemovementcalifornia.org, and they have a map. And, you know, they showed all of California, and you can zoom in, of course, and there's some villages here, or there's some things here as an example. There it says member of Village Movement California. It's in Palo Alto. So is that, and there's a phone number. Does that mean that they have a village set up?
That's
Or,
Yes.
probably
That's
Avenidas.
Avenidas. That's Avenidas.
Yeah.
That's Avenidas.
okay, so what does that's Avenidas mean? Is that like the villages where it's a 55
That's-
plus community, or is that something else?
No, it's not a community. Villages, they're an organization, a membership organization that's serving Avenidas, you know, that area of California.
Okay,
So we are not a facility-based organization. We don't have housing. You know, we are serving people that live in their own homes. Now, they may live in a facility, but they're a member of this organization. So think of
Okay,
it that
so-
way. It's
so whatever, so as an example, I know you mentioned they pair with Jewish Community Services or whatever. Is Avenidas, you know,
No.
connected to a church or
let-
some
let
other
me-
type of?
Let
I
me
don't,
just,
you'd have to go in and look at their organizational structure. Everyone's different.
Okay,
Google
and,
Avenidas
you
and
know,
see what they have.
okay,
Yeah,
yeah, there's a
and the-
website here. I'll take a look. I just
And
curious.
the village is just one of the spokes on all the work that they do. There's 12 of them for Avenidas. Maybe, Julie, maybe we should get them on as a,
Yeah, they're on
speaker
the
window.
list, on the agenda list. Yeah.
Okay.
well, you
All
should get Carolyn Ross or somebody from Village Movement California.
Yeah.
And she can talk about the accelerator. I mean, either that or Eric Larson. They're both co-executors of Village Movement California, but they'll have a better idea of, you know, what is happening in California and the process. They're trying, and I give them big kudos. You know, the national network is large, but when you have a regional group really concentrating on, you know, scaling the movement, especially since they were very active in getting in the California Master Plan, it's super important to connect with them. And I would have them on it.
Carolyn Ross, and then who was the other?
Eric Larson.
Okay.
They weren't around when we were trying to start the village in 2010.
No, it started in 2018.
Yeah, I can reach out to them and we'll get all caught up with them. That would be amazing.
That'd be good.
Anybody else have questions?
Well, my head is spinning because I just feel like we need, this is going to be such a platform of a resource that we can use to do what it is that we have in mind here as senior real estate specialists, especially just with our local network here of real estate professionals and affiliates.
Mhm.
Because here in Silicon Valley, you know, just like everywhere, we have little micro markets.
Mhm.
Micro and so where Avenidas is, nobody, it just depends on your geography, and their outreach probably doesn't go past, you know, the
It doesn't come down here.
county line, you know, or the city line, past Mountain View. And we're south of Mountain View. So it's just like that. That's how people behave around here. And we know that. So if we create small groups within this larger group, and I think this platform would really be a good resource to be able to do that. What do you guys think? Maggie thinks so. Yay, Maggie.
I agree. That's why I stay in touch with you guys and other networking groups that I belong to, because we need the resources for our seniors. You know, everyone that comes through my door, sometimes I'm not able to help them. So I go and look for that one professional that can help. And I do appreciate everyone that has worked with me in the past and throughout the years. So yeah, we definitely need that.
Good for you, Maggie.
Thank you.
Well, we each have our service our business model, but we're all here to serve senior homeowners and families of senior homeowners. And this whole, I don't know, Barbara, if you've noticed, but the real estate industry is morphing a little bit these
Right.
days. And as senior real estate specialists and realtors, we are moving into a completely new paradigm, a whole new dynamic in providing service to our senior homeowners and the families of senior homeowners. It's way beyond a transaction. And these are the types of things that Skip and I are endeavoring to bring to all of our colleagues and affiliates to be able to do that. So it is kind of a new frontier, and now we can bring this is a new concept. When we talk to people, we'll tell people about it and they'll go, what is that? And they'll go, oh, they've been doing it in Marin County for a long time. Here, let me show you. Oh, okay. So thank you so much.
Well, and also, I mean, like the city of San Francisco heavily supports their villages financially. So this is, you have a golden opportunity in California. They really get it. They get the model. They know they need the support structure as people are aging. We know that community-based services are the way we're going to help navigate the missing middle. And also, others, but it's I think, a reliable resource.
Well, I really appreciate your time and this learning about this your village to village network. It
Well,
just
thank you
again
for
it
inviting me.
gives me so many ideas. And
Good.
well, go ahead, Maggie.
No, I just wanted to say thank you. It was great information and another resource for our seniors. Thank you.
Good. Excellent. Thanks so
We'll
much.
just
Very
we'll
much.
just pick that ball up and run with it.
Hey, Barbara,
They'll email me. Yeah.
will we get contact information for Carolyn Ross?
I'll get
Uh,
that. I'll follow up on
Okay,
that.
great. Thanks, Julie.
Yeah. Oh,
Are you
I
sure?
will.
I can give it to you if you want.
Oh, that would be fabulous as well. Thank you.
Hang on. Yeah.
I'm ready.
I'm pulling it up.
That's okay.
Oh, of course. So it's Carolyn, CAROLYN at villagemovementcalifornia.org.
Awesome. And that's probably on the website.
It is. They're a great resource. Definitely reach out to them.
Yeah.
There you go.
That'll be our next well, I'll get right on that.
We need to
Alrighty.
do,
Go ahead, Skip.
we
Sorry.
need to do Avenidas too.
Yeah, we do. Yeah. Exactly.
Okay.
All right.
Terrific.
Thank
Thank
you.
you very much.
Thank you for your time
you.
and have a great week and
too.
we'll keep in touch.
Thank you so much.
Okay,
Thanks,
sounds good.
Julie.
Thanks,
Bye.
Thank you.
Bye
Hey,
now.
you guys, we can talk for a few more minutes if you got a few more minutes.
Okay.
And welcome to David. This is your first time here, and JD just got his SRES recently. That was in January. So excited about that. And for anybody who missed it, JD's from Folsom. So, and Rick, you're from Sacramento, but
Correct.
Rockland,
Yeah.
right? More like Rock.
Loomis, right next door to Rockland.
Yeah, Loomis. Okay. So I love it when we get people, all connected and get an idea in their head of the geography, because anytime we do have conversations, yeah, David, where are you at?
I'm right here in San Jose.
Yeah, exactly. Nice. David, so our colleague Diane Butcher, she recommended David connect with us, and they met at an open house. Was it Diane's open house?
Yeah, she was holding an open house for a listing over here by right off of Golf Links for Prune Yard, right over here by the Prune Yard Golf Course. So
Nice, nice, amazing. So I love it. People are talking. This is how it works. It's called networking. Go figure. I had a question for the crew just to get some feedback, because the next thing I'm working on is with us as SRES and working in with senior placement. And the senior placement, there's a couple of different ways the senior placement works. We've had a couple of different senior placement people on our program and speak to how it's working. And there's a couple of different ways that that industry works. So I'm thinking about putting together a whole separate panel discussion, Zoom, and probably hybrid Zoom.
Julie, do you want to record this?
I do.
Okay.
And so to get everybody's feedback on that, have a panel discussion, a separate Zoom meeting, and then see where we go with that and see what the interest level is in with that. And the reason why is because our business is senior real estate specialists and affiliates, because we all work with the same homeowners and families. We all are going to start to work more and more with these with the opportunity of placement, or with actual placement professionals, and with the sales and marketing and placement departments in the senior living communities. You know, it is such a humongous industry, and they spend a lot of money. They spend a lot of money on placement. It has gotten to the to where now we as real estate professionals and even affiliates can create a revenue path for when we place or connect people, connect our families to senior living communities. And there's a couple different ways of doing it. And so that's why I'm thinking about having, like I said, a separate Zoom meeting, hybrid, maybe like a panel discussion with all the different kinds of platforms that are out there, how it's going to work. Some of the senior placement agencies right now and professionals, they're not really happy about us moving into that space. So what I'm trying to do is create a collaboration, more so than a competition. That's what I'm always about. The other thing is, in Santa Clara County, you know, we do have the vacancy rate is, there's a small vacancy rate on units right now for senior living communities. We do have about 300 more luxury units coming online by summer. So, and the attrition, as you can imagine, in senior living, especially in dementia care, is fast. So this is an important thing. It's an important service that we can provide. I want to just, so send me any of your thoughts. What do you guys think? And keep an eye out for that. I appreciate it. If anybody has anything that they've been thinking about and want to put in the mix, like we do have Avanitas on the agenda, and I need more ideas. So if you guys have something in mind, tell me about it. Send it to me in the email. You can go on the Facebook page or the LinkedIn page. What do you guys think?
I mean, it sounds great. And are there any licensing requirements for you as a real estate agent to be able to, offer placement service?
So no, because that's outside the real estate industry. And and part of the, what I want to explain is exactly that. So, how any of us working with senior homeowners and families of senior homeowners can connect with, the senior living communities and the sales and marketing departments, and then other placement professionals in the area to create collaborations. And then we all earn from doing that in one way or another. And that's where it kind of gets complicated. And then we're ironing that out, at least I am. So I hope that answers your question, because it is brand new territory. And but one of our colleagues is in Las Vegas right now at the KW family reunion, and there's 18,000 realtors there.
Name them.
Yeah. Okay, so there's a teeny tiny SRES, but KW does have a significant SRES business. They've been doing it for a while. So they do have that going on. And so our colleague Catherine, who is there now, she's going to be talking all of this up, including that subject that I just described there. So she's going to find out what all of those people think about that as well. So that's going to be exciting when she tells us about what's going on with KW. And then Compass is coming up with their own seniors real estate division. So, and that's
Called?
called Compass Plus. So, our local Compass people don't even know about this yet, because we asked, especially Diane, she works at Compass. We have a lot of our colleagues, especially in our group, that work at Compass, and they're doing their Compass Plus. What's that? I'm like, well, go ask your broker, because if you walk into your managing broker's office at a Compass office and say, hey, I want to know about this Compass Plus, and they will not have any clue what you're talking about. That's how new it is. But we're on it.
It started last August.
Exactly. So this is the wave of what's going on. Yeah, well, Joe, say that out loud.
Yeah, we'll create a BRG plus for a senior. Let's do that, Julie.
What am I doing already?
Right.
We landed there. I did. So, thank you, Joe. You're right. Oh yeah. Okay. So now that you mention it, I don't know if you guys reviewed in the bulletin, but we are doing a 55 and over resort community called Twin Oaks Hollister. We're doing a luxury bus tour and lunch. It's on the bulletin. It's in my email, and that's coming up next week. So anybody who's local and interested, Mickelin, you might want to join us. That would be so much fun. And I'm going to make a feature out of it. There's another development that Valerie found out in Tracy that she's checking them out, and I'm going to vet them out, and we might make a bus trip out there. But Joe,
Did you confirm my
lives,
registration?
Yeah, you're on it. So
Okay.
earlier this week, I reviewed all the listings out at the Villages. Joe lives out at the Villages, which is our 55 and over resort community right here in San Jose. You live there. There's, I don't know, I think it was 18. There's about 18 listings, active listings right now out there. So I was thinking our next bus trip and lunch should be out at the Villages. What do you think, Joe?
We could arrange that, except Villages does not allow open houses, so that.
No,
one
not open
could be-
houses.
Yeah.
I know they
Oh.
don't allow open houses.
Right.
So I think that should be our next place. A lot of the listings at the Villages, there's quite the variety of members only all the way to long days on market. So I'd like to figure out, maybe Joe, you have an observation about that.
Yeah, it depends on which village they are in, because they are somewhat different. Some of those you see there for a long time because they are two-story. Nobody want non-senior don't want to buy move into a two-story. So those are the ones that takes a little longer to sell. But the good one in good area, they're gone fast. Those,
Yeah.
You also see some of them, they haven't been upgraded since they moved in 20, 30 years ago. Those are the ones take a little longer. But
Mhm.
the upgraded one, they go fast.
Yes.
That's the general observation. Yes.
Mhm. And so then the other thing that I was connecting to, especially as for us as realtors, is if that it is good inventory for us to sell. Okay. So and that we can take to our databases, our farms and whatnot, and then put the information out there. All right, everybody. Thank you so much for joining us today.
Thank you for
Julie.
inviting me. It's nice to meet everybody.
Thank
guys have
you,
a great
David,
day.
for joining us. Again, this is a networking meetup type style. You'll get a bulletin from us every week. And if you guys get any ideas, just ping me.
And next week we have,
Next week we have you tell them because I'm having a brain fart.
well, we're
Brain
having
fart!
the Pulse
Oh yeah.
forum. We're going to have the people from Compassionate Care, whatever it is, the 4Cs, and
Yeah.
they're the ones that have the Pulse form, and we'll learn about that.
The Pulse is physicians
Physician orders,
ordered
sustaining life treatment.
life-sustaining treatment. It's a document that we all should have and not just seniors. I mean, it's a document that first
Illegal.
responders look for when if you get called 911 on and the first responders
Well,
will
it's more for like transporting from, home to hospital or something like that. It's
that
a
too.
signed
Yeah.
agreement between you and your doctor,
Yeah.
and we'll learn more about it.
Yeah. All right, everybody. Anything?
Thanks, Julie.
Okay. I appreciate you guys. Thank you so much.
Thanks,
You guys
Julie.
have a great week.
See you on the
Bye-bye.
27th.
I'll see you at the office, Joe.
Yes.